Hello, my name's Lucy. I'm one of the specialist palliative care team nurses for the Trust, and I'm here today to give you a few tips on having difficult conversations, especially through the COVID-19 outbreak, where we know unfortunately we're not able to offer face-to-face support to relatives, and you're going to be needing to have a lot more conversations over the telephone. Some of these are going to be extremely difficult and breaking bad news on the phone. So I'm going to give you a few examples. They're not scripts, these are more for you to go on and to give you some support. So please don't feel that you're doing anything wrong throughout this. This is all about individual circumstances and offering the best advice and the best support you can at that time. So when you have the telephone conversations, just start by introducing yourself and giving them your name. Speak as slowly as you can. Try and find the quietest spot you can, as we appreciate really busy wards, but just try and find yourself a quiet spot and maybe try and tell your colleagues that you're going to be making that difficult conversations so they can be a little bit more quiet around you. Start by asking who the relative is that answers the phone and ask them if they're all right to talk. Try and find out if they've got any support around them, because that might be crucial at that time. If not, if you can, try and arrange to ring back. If you can't, then just carry on the conversation as best you can. Ask the patient's relative to start with what they know about the situation and what they know about the condition. That way you might not need to break all that news. You may be able to then follow the lead of that relative and then save some distressing new information being given. Share the information in small chunks and use simple language that will be easily understood. That way you will avoid any miscommunication and try and avoid any medical jargon that they don't understand. Try and be as honest as you can and try and stop any uncertainty. This will help the relative understand what you're telling them. You can talk about the treatment that they've already had and try and explain the patient's journey to the point where you're at now, especially if this conversation is going to be to tell the relative that the patient has passed away. Talk about where their journey has led them to this point now. If the patient has died, tell them in a clear way and then give them a pause to think about things. The patient's relative may be really angry and really upset. This is normal, and allow the patient to feel this way. Tell them that you understand and allow pauses. You may not be able to get to the bottom of everything in one phone call, so try to signpost the relative that they will be followed up with a bereavement call and there is other people that they can speak to get support. When you finish the conversation, try and summarise and try and give time for the patient's relative to ask you any questions that they may have. This will be really important for the family, just to be able to recap what they know and give them time to ask for any more information. Tell them if they need to, they can call back with any further questions, or tell them who would be appropriate to call back. At the end of the call, take time to speak to your other staff members if you can and debrief. There is lots of resources available at the moment in the Trust, and these are changing day by day. So go on the Trust internet, find out where those resources are and try and use them at the end of the shift or when you can. And also there is #WeAreAllHumans, which is about having conversations with colleagues about these conversations. We appreciate these are very difficult conversations. We as a team are used to having these conversations every day in our normal role. So we are here as a resource to talk to you and support you where we can. So call our team. We're available via Bleep on 249, or contact our team secretary who will put you in touch with us. There is no right or wrong in any of this. It's just about being as caring as you can and giving that information. Thank you.